Hi, my name is Faisal Khawaja and I'm a pharmacist and the lead Naloxone trainer at Marchese Pharmacy in Hamilton, Ontario. The opioid crisis continues to claim thousands of Canadian lives every single year. It now outnumbers motor vehicle accidents as a leading cause of death in our country. I'm here to provide you with some information and tools to help you save a life in your community. Remember, every life matters. So here are some signs and symptoms to look for to determine if the person might be having an opioid overdose. 1. Their breathing might be very shallow or labored. They might be making choking or gurgling sounds, or their breathing might be stopped altogether. 2nd, their lips and fingernail beds might be blue or purplish in tone, indicating that lack of oxygen. To be sure, you can turn the lip outward in order to be able to see better. 3rd, their skin might be cold or clammy to the touch. 4th, the pupils of their eyes, if you happen to open them up and take a look, the pupils of their eyes, which is the dark part in the center, might be tiny. Tiny or pinpoint pupils are a hallmark of opioid use. It's important to note that you do not need to check for a pulse in order to consider administering naloxone. If you see one or more of the signs and symptoms that I just mentioned, you might consider that this person is having an opioid overdose and proceed to the next step and call 911. So we're here today to show you how to draw up a dose of naloxone injectable. All of Marchese's naloxone kits for injection contain 2 Vantage Point syringes, safety syringes, a CPR face shield with a one-way valve, a signs and symptoms sheet, 2 alcohol swabs, a 5-step reminder card, two doses of naloxone, and a pair of non-latex gloves. So I'm going to demonstrate to you how to draw up this dose. First of all, you put on your non-latex gloves. Then you're going to take one of your vials of naloxone and you're going to pop the cap off, just like that. Take one of your Vantage Point syringes, open at the end, it peels open, and you can take out your syringe. Okay? You're going to draw into the syringe 1 cc of air. So there are 2 black rings. The upper black ring lines up with the 1. Okay? So then you will remove that cap very carefully and just set it aside. And then you will find the center of that rubber port. Take your needle with the bevel side up if you can, insert it carefully into the center and just push it all the way in. Okay? And now what you want to do is push up the vial so that the needle tip is just at the bottom of the vial. And you should be able to see that through that little window. Now what we're going to do is we're going to push in the air and then we're going to pull down the plunger. Okay? So pushing in the air, pulling down the plunger. We're just going to repeat that until we no longer have liquid coming in. And we're just going to double check, make sure the needle tip is as far down into the bottom of the vial as we can, and then just draw down a little bit more. Okay, if we get a couple more drops, that's great. We're not going to spend a lot of time getting out every last drop. At that point, you can take the vial off of the needle tip very carefully. And because there's air in here, we want to remove the air. Pull down in case there's a little drop at the top, and then push that all the way up until only liquid is left in and then the air is completely evacuated. You should see a little drip of liquid come out the top, or it might spray out like that, which is perfectly fine. Okay, so now we've drawn out the entire quantity of that vial, which should be approximately 1 milliliter, and then we're going to be ready to inject. Okay, so once you've drawn the dose, you need to locate the site of the injection where you're going to put the needle. So what you're going to do is just find the spot on the deltoid muscle, and normally what you do is locate from the end of the shoulder bone. There's a little groove where that bone ends. From there, you would want to go put your first finger there, second finger beside, third finger beside that. So anywhere below that spot should be a good spot for the deltoid, the heart of the deltoid. You can also give a bit of a squeeze to locate. You can feel where that muscle runs, and it's in the shape of a triangle roughly, so the bottom of it ends about there. So if you go like that, you can actually see where the injection site would be, okay? So what I'm going to do is I'm going to take the needle, I'm just going to give it a bit of a stretch here with my hand, put the needle in, give the injection. At the very end I'm going to push more with my thumb, and that withdraws the needle, okay? And then I'm going to massage the naloxone into the arm, and I'm going to observe for 10 seconds to see if the victim is recovering. Now, if for any reason you feel like the deltoid muscle or the arm muscle is not available to you, or it's not practical for you to inject there, you can inject in the thigh, okay? And how you want to locate the injection spot is find the start of that thigh muscle just above the kneecap, and you can locate sort of the top of the thigh muscle just at the groin level here. And imagine that this section is divided into equal thirds, okay? Here's one third, here's another third. This middle third is your ideal spot. Now you can inject directly on top, but if you inject slightly outer aspect here, this is a preferred location. This is the medius part of the thigh. So that's your alternate location. And you can choose the arm or the thigh, it doesn't matter. Just make sure that the victim doesn't have anything in their pockets like a wallet or keys or anything like that that might impede the needle's progress. In the case of naloxone spray, all of Marchese's naloxone spray kits are found in blue cases just so they can be readily identified and distinguished from the injectable kits. Inside there are 2 doses of nasal spray. Okay. They look just like this, all right? And what you have to do is turn it over and just peel off the foil, remove the paper, and there's your single dose of naloxone spray. Okay, and what you want to do is, of course, making sure that your gloves are on, you have your thumb on the bottom and your fingers on either side. You're going to approach the victim, make sure that you insert the nozzle all the way up into the victim's nasal passage until your fingers touch the nostrils. Then you're going to get a firm push on that plunger, which is going to shoot that medication into the nasal passage for absorption. Then the same way that you would have for the injectable, you're going to count to 10 seconds and look for signs of recovery. And if there's no recovery, then you move to the next step, which is CPR. So once you've administered the naloxone and observed for a count of 10, if you notice that the victim is not responding, then the next step is to go and provide CPR. Now, modern CPR does not stress the importance of giving rescue breaths. However, in the context of opioid overdose, the victim fundamentally is going to die from a lack of oxygen, which will lead to cardiac arrest. Okay? So we feel that it is very important for the rescuer to strongly consider being willing to give rescue breaths to the victim because they need air and you're going to provide them with that air, okay? And it's understandable that in the context of a worldwide pandemic that people might be hesitant to do so. Therefore, all of Marchese's naloxone kits contain a CPR face shield with a one-way valve. This means that when the rescuer gives a breath through the mouthpiece, through the valve, nothing comes back up to the rescuer from the victim. Okay, so this is a very, very important safety feature for the rescuer. Now, in order to use a face shield, the first thing you want to do is, of course, approach the victim. You want to open up their mouth because you want to see if they have any contents in their mouth, any food or vomit or gum or anything like that. And if you do notice anything, you can just grab their tongue, move it out of the way, and just swish out the contents of their mouth with your finger. Of course, you have gloves on to protect your hands as well, okay? And then the next thing that you want to do is open up your face shield, find that mouthpiece. The mouthpiece is for the victim, it's not for the rescuer. So what you'll do is you'll insert that into the victim's mouth very carefully. You'll drape it over their face, okay? And you should be able to see that the writing, you should be able to read the writing on the face shield. You know you've got it the right way, okay? Then what you're going to do is you're going to raise up the victim's chin, okay? This will straighten out their airway, and then you're going to pinch their nostrils, and then you're going to give a breath through that valve. There will be some resistance because of the presence of the one-way valve, okay? But that is normal. You should look for the chest to just begin to rise. Out of the corner of your eye, you'll see that. Then you can let off and then let the chest fall, okay? And then give another breath through there, and then watch their chest rise and fall. You give 2 breaths like that, and then you switch to chest compressions, okay? In order to give chest compressions, you might have to manipulate the victim a little bit, okay? You might have to move their arm in order to be able to get into the position. What you want to do is take a hand, nestle it up under the armpit like this, and then pull it straight across the chest, and the butt of your hand should now be located on the lower part of the sternum where you're going to apply the compressions. All right, then next thing you want to do is interlock your fingers, lock your elbows, and then you're going to give 30 compressions at the following rate. 1, 2, 3, 4. Staying alive, staying alive. If you follow that rhythm, that's the right speed, and you want to count to 30 that way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 2, 3, 5, 6, 7, 30. Now we're evaluating the victim. If not, they're not recovering, we're going to give them 2 more breaths, okay? So following the same procedure as we did earlier. We're going to follow that cycle of 2 breaths, 30 compressions, 2 breaths, 30 compressions for a set of 4. And we're going to evaluate all the while to see if the victim is recovering. Those compressions are helping to circulate that naloxone so that it can get into the bloodstream and get into the victim's central nervous system to help them recover from the overdose. So when we notice that the victim is beginning to recover and the naloxone is doing its thing and your rescue breathing and your CPR is taking effect, at any time if the victim begins to show signs of recovery, of course, which are the opposite of the signs of overdose, so those recovery signs would be their color is returning, they're breathing spontaneously, they might be moving around, they might be making sounds, okay? At any point, if you see signs of recovery, you want to put the victim into the recovery position, which is step 5, okay? And how you do that is, you're going to raise up one knee, okay? And you're going to raise the same side elbow, and you're going to use those as levers to roll the victim onto their side, okay? And draping this knee over, we're going to pull the lower arm out straight, and the upper arm is just going to be tucked underneath their chin, okay? So this is the recovery position, which makes it more easy for the victim to breathe. And if they happen to vomit, which can happen, they're less likely to regurgitate on it, okay? So this is the recovery position that you want to hold the victim in, and then just remain with them until help arrives.